guys, we are live at Motion, and I am with the pelvic floor physical therapist that I saw, Dr. Jen. I saw her after I had Bella, and we just answered a lot of your pelvic floor questions, and that's going to be coming to the blog later this month. But since I had Jen here, I thought, how cool of an opportunity to just show you guys live how you examine for DR.
Yeah.
And I'm gonna let you introduce DR and talk about what it is, and then show me how to check for it.
Sure. I'm gonna have you go down on your back first. So Diastasis Recti, or DR, is when we experience kind of separation of our abdominal muscles. There is tissue that lies between those two abdominal muscles called your linea alba, and when you're pregnant, your body has to make room for your baby, so that linea alba gets stretched. And then after you have your baby, for some women, things kind of come back together. For others, that linea alba stays a little bit more stretched and lengthened. So to check to see if you have DR, what you can do is you're gonna kind of find your belly button first. So I'll be here, and then what I'm going to do is go about 2 inches above her belly button. I'm gonna have her go ahead and lift up her head and shoulders off the table. And so what I kind of do is just find those 2 walls with my fingers. I just kind of go side to side, and right here I feel 2 fingers width of a gap, but I feel pretty good tension across that linea alba. You can go all the way down for me. And then I'll go back down to her belly button. Typically, this is where I see the most separation. It just tends to be a little bit more weak in this area. I'll go ahead and have you lift up your head and shoulders again. And here I feel about 2 fingers as well, just kind of going from side to side. Good tension across her linea alba, and they'll come back down. Good. And then we'll go about 2 inches below her belly button. Go ahead and lift up. Perfect. And I don't feel anything here. So that's a way that you can kind of test on your own, is starting 2 inches above your belly button, at your belly button, and then 2 inches below your belly button. And you can kind of assess how big you think that gap is, and if you feel like your fingers that linea alba is nice and firm underneath your fingers, or if you feel like there's a little bit more give there.
Yes, and so that was something I thought was really interesting that I learned from you.
Yeah.
So I typically just, like, a lot of people think that DR is just about the ab separation.
Totally.
But the tension that you can generate across your linea alba with your deep transverse abdominals plays into it.
Exactly, yes.
So can you talk to that?
Yep, so we consider a diastasis recti positive when it's greater than 2 fingers, but again, it's just not all about that gap. It's more about the ability to generate tension across your linea alba so that your core muscles can work together when you're doing daily activities and you can feel nice and supported. Awesome.
And so exercises I should avoid if I have significant DR, or I'm not able to generate tension, or it is exercises to avoid.
Yes, exercises to avoid. So if she were to lift her head, and I kind of see like doming or coning here, where that tissue, the kind of force is kind of being generated through that linea alba, it might be an exercise that she's not quite ready for yet. It doesn't mean that she can't ever do that exercise, but it might mean that we need to adjust things a little bit or play around with that. It's something that's perfect for her at this time.
Yeah, awesome. Yeah. And speaking of core activation, can we do the 1 tip? Because this was the 1 tip I thought was really great for helping me work on healing my DR personally, the hip bones.
Yes. So in order to find your transverse abdominis muscle, what you can do is find your hip bones here. You're going to go about 1 inch in, and then I want you to do a little fake cough for me. Perfect. So she's going to feel those muscles kind of pop into her fingers there. That's transverse abdominis. Then what she'll do is she'll take a big breath in through her belly, and then as she's exhaling, you want to imagine that there's a string attached to your 2 hip bones, and as you exhale, you're pulling your hip bones together with that string or with those transverse abdominis muscles. So we can go ahead and just show you one more time. You take a big breath in through your belly, exhale, you're imagining those hip bones come together to activate those muscles, and you'll feel them kind of tighten up underneath your fingers.
Yes. That's been so helpful for me in all the core work that I've done, is just constantly thinking about bringing those hip bones together.
Exactly.
A lot of times you hear just like push your back into the mat or pull your belly button to your spine. But this is such a better visual, I feel like, for me personally.
Yes.
And work on holding that for like 10
It's hard.
seconds.
It's really hard. Yeah, it's not necessarily something that we always think about, but it's just so important.
Yes. Thank you so much,
yes,
Dr. Jen. She is a wealth of knowledge, you guys. So if you're in the Minneapolis or Minnesota area, check out Motion and get a pelvic floor appointment with Dr. Jen. And stay tuned, because later this month we're going to be releasing the top 10 questions you guys asked about pelvic floor health, and Dr. Jen answered them, and it's awesome.